Talking about a really disturbing trend. Youth suicide rates are on the rise across the U.S.
In fact, research from Yale University shows suicide is now the second leading cause of death for people ages 10 to 24. Researchers found a 62% increase in suicide-related deaths for that age group between 2007 and 2012.
That rise is even more notable in younger populations. According to the research, suicide rates among preteens or those aged 8 to 12 increased annually by 8.2% from 2008 to 2022. Female students and LGBTQ plus youth are twice as likely to have suicidal thoughts and are more likely to attempt suicide.
In an effort to understand more about what's contributing to the rise in youth suicide, Virginia Tech, Carilion School of Medicine, and Carilion Clinic launched a brand new study.
Yeah, we are joined by that study's author, Dr. Abhishek Reddy, to discuss the preliminary findings of that study. Welcome to Here at Home. Thank you so much for being here.
Thank you both for having me.
Now, you may have heard in the news, we've had a couple of recent teen suicides right here in our area. As a physician, have you noticed an uptick in the number of teen suicide attempts?
Absolutely. The trend has been rising nationwide, and we also see it in our hospital. I work on inpatient unit, and we see numerous kids with overdoses admitted to the hospital.
Yeah, and did that inspire your research?
Absolutely. So since our team and me were seeing like an uptick in overdose by teenagers, I was curious about what are the factors that are causing or resulting in this overdose, and the findings were pretty interesting.
Yeah, and you found that this tended to happen at night after screen use. Talk a little bit about that connection.
Yes, so we looked at 6 months of data, and what we found out was in the kids that overdosed on pills to kill themselves or hurt themselves, 2/3 of them were between 8 p.m. to 6 a.m. and 3/4 of them were on the screen right before the overdose. And that's a strong connection if you look at it.
Yeah, absolutely. So let's talk about some of the patterns that stood out most to you in your research.
So access to screens right before going to bed, poor sleep, that was a strong connection, and access to over-the-counter pills. Those three in combination, it led or it resulted in overdose by suicide.
Yeah, and I think, sleep is so crucial. We talk about it all the time with health of, all of us from adolescents, children, adults. Talk a bit about that. Is it that sleep interruption that you believe plays a role in this?
That's a very good point. So poor sleep in itself can cause a lot of mental health issues. It can cause depression. It can make you irritable. But there's a little bit more to it. At night, our brain is kind of going on an overdrive. A lack of sleep in combination with stimulus at night, for example, screens.
Sure.
We always talk about it. During the daytime, we have multiple factors that can help us if we are distressed. But at night, all those factors are cut off. For teenagers, parental access, parents might be asleep, school counselors might not be available, you're alone and you're looking at triggers on your device, and anything like even sad songs can be a trigger, and you don't have any coping mechanisms. And that in combination to access to over-the-counter pills or medications of your parents or your own prescribed medications, it's a dangerous combination.
Wow, this is really eye-opening, and I think that a lot of parents are, finally just kind of thinking, okay, I need to do something because this is a crisis among our teens. It's a crisis really everywhere in our society. What can we do as parents to really protect our children? Number one, I'm hearing get the screens out of the rooms.
Yes, so, and that's I think the important part of our study is it has tangible and very helpful tips for parents. The first one is, even for parents, but mainly for the kids, have a good sleep routine and a good sleep schedule. So going to bed on certain times, having relaxed activities at night time, those are pretty important. Do not have screens at least an hour before going to bed. And those are standard recommendations by all organizations, so kind of sticking to that. And the third and the main thing is limiting access to pills for teenagers. It can be their pills, other people's pills, especially when you kind of figure out like, okay, there are some stressors going on, or if there are other things that are stressing the kids or teenagers, like taking access away from the kids, that is very important.
Yeah.
Those are like really 3 easy steps that parents can take to help heartache and then problems and medical problems.
It does
And
sound simple.
It does sound simple, and just
Yeah.
having that line of communication, because it does sound like they are so isolated, as you said, just a few minutes ago. It's bedtime, the parents are sleeping, they
Yeah,
don't
they're
have that
alone.
access. They're alone.
Yeah.
Yeah.
And I think
Absolutely.
that's a factor which has been found in multiple studies nationwide, even in adults, but more so for teenagers, when they have less coping skills at night, and these triggers, which could be bullying, which could be something they see on the online or internet, some sad songs, all of these, they can be a big trigger, especially at night.
Just keep
Yeah.
the screens out of the bedrooms.
Yeah, the
Absolutely.
brains aren't getting a
Yeah.
chance to relax and really, stay away from all that stimulus.
Absolutely,
Yeah.
absolutely.
Good reminders for all of
It
us.
is.
And fascinating findings.
Yes.
Thank you so much for being here and sharing
Thank you.
all of this.
Thank you.
Yes,
Thank you for
okay.
spreading this awareness.
Yes, absolutely.